Hello, class. Hope everyone's doing well. I did my genetic disorder project this year on cystic fibrosis. So let's go ahead and get right into it. So, kind of the basics of cystic fibrosis. It's an inherited genetic disease to which there is not a cure. So that means a person with cystic fibrosis will live with it for their entire life. And according to the National Institutes of Health, the physical effects of this inherited disease include a constant and consistent buildup of sticky mucus that over time damages a body's organs. Effects related to the digestive system typically include some level of damage to the pancreas due to the mucus buildup, and this damage can cause issues with insulin production, the body's ability to digest properly, which could lead to malnutrition and growth associated during childhood. So kind of a list of affected organs by cystic fibrosis include the sinuses, lungs, where you develop the thick, sticky mucus and they're susceptible to bacterial infections, skin, where the sweat glands produce a salty sweat, the liver, which will result in blocked biliary ducts from the mucus, the pancreas, which has blocked pancreatic ducts, the intestines, which get lined with that thicker mucus, which results in they can't fully absorb nutrients properly. And so most of the effects are seen in the patient's respiratory system and their digestive organs. And the effects on the lungs of cystic fibrosis is, again, that buildup of the sticky mucus, and that limits the body's ability to respirate and exchange gases, which can result in shortness of breath and difficulty breathing. And on top of that, the higher likelihood of developing bacterial and fungal infections. And you can see here in the infected cystic fibrosis lung, we have that buildup of mucus that affects the alveoli and gas exchange, and that's where that shortness of breath comes from. And also that mucus can build up in this upper airway here too, and result in kind of less airflow moving in and out of the lungs. And though cystic fibrosis is considered to be a fatal childhood disease, research and breakthroughs related to the disease have allowed children to live pretty well into adulthood. And though complications for adults can include diabetes, just general deterioration of the lung tissue, and issues related to reproductive organs as well. So the cause of cystic fibrosis, it's caused by a mutation in the cystic fibrosis transmembrane conductance regulator gene. It's kind of a mouthful, so you just can say CFTR gene. It's located on chromosome 7, and this cystic fibrosis is inherited in an autosomal recessive manner. So the autosomal recessive mode of inheritance means that both copies of the gene in each cell must have mutations for someone to have cystic fibrosis. If just one of the genes was mutated, a person would be a carrier, but they wouldn't be afflicted by the disease. Let's take a look at the CFTR protein. It's shown here in green. And it's a pretty big protein. It's composed of 6,129 amino acids. And kind of in short, it helps the body maintain the balance of salt and water on surfaces like the lungs or the digestive organs. And this 3D model of the CFTR protein was developed in 2017. It wasn't developed until recently just because of the complexity of the protein. And when it's functioning properly, it functions as a chloride ion channel across the membrane of cells that produce mucus, sweat, saliva, tears, and other sort of digestive enzymes. And this protein channel helps to regulate water movement in the cells, which creates a thinner mucus. When it's not functioning properly, the chloride becomes trapped in the cells, and it can't move water to hydrate cells, the surface of cells, so that results in that buildup of the thick and sticky mucus because chloride ions aren't helping regulate water balance in the body's cells. So we all know about Punnett squares and how they're used to predict genotypes in a crosser or breeding. So we'll just kind of look at a few Punnett squares and their relationship to cystic fibrosis. And remember that the mode of inheritance is autosomal recessive. So that means in these Punnett squares, both genes must have the double lowercase f genotype, or what you would call homozygous recessive. So here, the top left, we would see two people that have cystic fibrosis having offspring, and they would create someone with cystic fibrosis every time. When you have someone that is homozygous dominant with homozygous recessive, everyone would become a carrier. Top right, if you see that we have a carrier in homozygous recessive, they would 50% of the time create a carrier and 50% of the time create a child that has cystic fibrosis. And then lastly, there's a simple one. Both are homozygous dominant and they're in the clear, and none of their offspring would have cystic fibrosis. And so moving on, kind of a more complex version of the Punnett square, getting into ancestry and generations of children, we have a pedigree. And we know that it's a diagram that shows the occurrence and appearance of phenotypes and genotypes of a specific gene and how it affects ancestors from one generation to the next. We can see here it has 4 generations, and it has 21 people in it. And just a brief overview of a few of the offspring. You can see here Ronald and Sarah are both carriers of the disorder. And they might not even know it, but they do have a 25% chance of having a child with cystic fibrosis. And they had 2 children here that had cystic fibrosis. And if you see one of their offspring, Charlie, that has it, is married to Lindsay, and they have children, it increases even more, where they have a 50% chance of having a child that's afflicted with the disorder. So that's kind of the overview of pedigree and how cystic fibrosis is related to a pedigree. Now, moving on to frequency, you can see that it occurs across all races, but it occurs most frequently in Caucasian populations, for 1 in about every 2,500 to 3,500 newborns. And it affects about 30,000 children and adults every year in the United States, and about 70,000 worldwide each year. And another interesting fact is that it's estimated that about 12 million people, or 1 in 30 in the USA, carry one cystic fibrosis gene mutation. So that's why it's important to be tested before having children, because you could have a child that has cystic fibrosis and not know that you and your wife were both carriers. The testing for it is kind of involves the newborn screening test and a sweat chloride test. And all newborns are screened for cystic fibrosis in a broad newborn screening. And the genetic testing for cystic fibrosis is performed during the first few days of a newborn baby's life. Typically, a prick of blood from the heel is applied to a Guthrie card, which is then mailed for analysis at a state lab to screen for cystic fibrosis and other kind of general health conditions. And you see here a newborn's heel is being pricked and blood is being applied to that Guthrie card for analysis. If that comes back positive for cystic fibrosis in the newborn screening, then further confirmation is needed through a sweat chloride test, which will ultimately confirm the diagnosis for cystic fibrosis. And that needs to be performed from about 2 to 4 weeks of age. Since newborn screening is relatively new, not all adults have been screened for cystic fibrosis. So if they have symptoms that become prevalent in an adult or a teenager, doctors typically perform a genetic test paired with that sweat chloride test. Early diagnosis is super important in cystic fibrosis, as it can lead to having better nutrition and being a healthier child when you're diagnosed early. And just a few general benefits include improved growth, healthier lungs, reduced hospital stays, and increased lifespans when someone is diagnosed early with cystic fibrosis, so they can get treatment started quickly. You can see here there's a child undergoing a sweat chloride test. They kind of put a chemical on a piece of skin, and then they put a little electronic stimulator here on you can see it on this baby's wrist, which helps encourage the sweat glands to produce sweat for this test. And then finally, treatment options for cystic fibrosis. As I stated earlier, there isn't a cure, so the treatments are kind of aimed at easing or reducing symptoms and lowering the risk for complications associated with cystic fibrosis and improving quality of life. Airway clearance is a big one. and it helps loosen the thick and sticky mucus so it can be cleared by the lungs through either coughing and huffing. And this is done through kind of chest physical therapy, utilization of certain breathing techniques, or the use of a mechanical device to loosen that mucus buildup. Um, with new and advanced treatments for cystic fibrosis, enrolling in a clinical trial can help treat symptoms and generally increase quality of life for the patient. So that's always an option, as clinical trials are constantly ongoing for cystic fibrosis. Medications are super important, and there's a huge variety of different medications that are administered to different patients. A few include antibiotics to help treat or prevent lung infections, anti-inflammatory medications to reduce airway swelling, bronchodilators, they help reduce smooth muscle in the airway. Excuse me, bronchodilators help relax smooth muscle in the airway and keep the airway open and patent for increased airflow. And then lastly, another medication is pancreatic oral enzymes, and these help the digestive tract to absorb more nutrients because they're limited in their ability to absorb when that mucus is lining them. And then kind of a more last resort intervention is the transplant of both lungs. And this is needed when resistance to antibiotics is paired with increased and often severe breathing problems. And cystic fibrosis will not recur in transplanted lungs. However, the risks for sinus infections, diabetes, or pancreatic problems can still persist after someone has had a lung transplant. And then lastly, kind of thinking about life expectancy for someone that does have cystic fibrosis. Now it's moved up between around 37 to 38 years, and treatment options are constantly evolving, so it is and improving. So it's estimated that the number is going to increase every year, which is really great to hear. And is 37 to 38 for someone with cystic fibrosis is super good, considering in the early 60s it was right around 10 years old was the life expectancy for a child. And then just to wrap it up, when that early diagnosis, when a child does have cystic fibrosis, it's key to diagnose them early, because these treatment options can really help a child's quality of life and help them live a more healthy childhood growing up. So that's an overview of cystic fibrosis. Here's kind of a list of the references I used for this project. I hope everyone had a great semester, and I hope you enjoyed learning about my presentation. Thanks.